Oh,
Very good. Is everyone able to see the presentation? Okay, all right. It's not showing up on that. Oh, maybe on the very big screen. Okay. First we're gonna just kind of talk about what is the goal of I Promise Health Quarters. So the goal of I Promise Health Quarters is a new facility where everyone can access comprehensive, holistic, whole person healthcare services for the entire community. So before we talk about the integrated care between our two organizations, we'll kind of split off into talk about what is Access Point as a whole, and then we'll talk about Coleman, and then we'll bring it back together towards the end. So Access Point Community Health Centers, for those of you who don't know, our mantra is to provide a quality, affordable, and compassionate health home for every patient, every time, in all communities. So what's our vision? Our vision is framed by the concept that health is a human right and not a privilege. It's to be recognized as a leader in the delivery of high quality, integrated, family-oriented healthcare and as a model program for community-based primary care. This process requires us to be integral partners with the community in the promotion of health, education, and access to care. So just a little bit about Access Point. We've been operating for about 28 years now, opening in 1995. Our original name was Akron Community Health Resources, and then we've transitioned to the name of Access Point Community Health Centers. And just a nice little fact about us, we were the first FQHC, which stands for Federally Qualified Health Center in Summit County. Just a couple other facts about us. We are a National Committee of Quality Assurance Center, certified center, and then we are also a member of the National Health Service Corps. All right. So Access Point currently has 4 permanent sites and a fifth location is our mobile unit, serving the Northeast Ohio area in both Summit and Portage County. We have 2 locations in Akron, I Promise Health Quarters, and our South Arlington Street location in Akron as well. And we also have a location in Barberton, Ohio, Kent, and then our mobile unit that goes out to the community all throughout the counties. Talking about specifically about the I Promise Health Quarters and the services that we offer. So we offer medical, and within the medical realm, we have a full-site pediatrician, our full-time pediatrician on site, Dr. Oriende. We also have a doctor that's on site a couple days a week who specializes and focuses on MAT services for those that are going through substance and alcohol abuse. And then we have a combination of doctors and nurse practitioners that are here throughout the week as well. And a great thing about our providers here at Access Point is all of them are family focused. So we kind of call it the cradle to grave mentality or method of treatment, where we can see a 6-month-old baby or anyone 100 years old or more in every age and demographic in between for their primary care services. So even if the pediatrician is not here, for example, any other of our providers can see a child because they are family medicine focused. At I Promise Health Quarters, we offer dental services. We kind of lump that into 2 categories. We have basic dental and advanced dentistry. So the basic dental services would be your cleanings, x-rays, exams, fillings, and extractions. And then on the other side of it is the advanced dentistry. So we offer crowns, we offer both lower, upper, complete dentures. We offer night guards, flippers, occlusal guards, and also offer teeth whitening. So that kind of falls into our advanced dentistry category. We also at I Promise Health Quarters offer optometry services. So we have 2 optometrists that rotate throughout the week here, providing eye exams. We can make sure if you do have glasses, the prescription you have is a good fit for you based on your prescription strength and your lens strength. We currently don't make contacts or glasses on site, Something we've thought about, but right now we're focusing on the eye exams and making sure your eye strength and your eyesight is where it needs to be. And if we need to refer you to get a prescription, we can write that prescription and we can refer you to a place that you can get your glasses from. We also have an on-site pharmacy. So think of our pharmacy just like your CVS, Giant Eagle, Walgreens. But I think it's even better. And not to be biased, I think it is better. In the sense that if you have an appointment here and you are prescribed a medication, you can get that medication within 15, 20 minutes, and get that medication and go home or go to work or wherever you were going. You don't have to come back, or it's not going to be, you're not going to be waiting an hour long to get your prescriptions, waiting in long lines that you may have to at the CVS's, Giant Eagles of the world. And another great thing about our pharmacy is that people are eligible for home delivery as well. So if you're someone who can't get their prescriptions easily and needs refills, we can bring those to your home. And then at HealthQuarters, we offer the behavioral health services via Coleman.
And we'll talk a little bit about that later as well.
This is just a little bit more about Access Point. Like I said earlier, we do treat patients of all ages. This is just a little bit, this bottom section here is just a little bit of breakdown of the percentage breakdown of population that is underserved that we serve here at Access Point. So about half our patients are white. 20, and then the other 50% are a combination, 25% being Black African American, and then the other 25% being another race. So you're Hispanic. We have a high Hispanic and Nepali population that we serve in the communities that we operate in, which I know a lot of other health centers are not able to do. We're able to accommodate those that English is not their primary language. We have staff members that speak fluent Spanish. We have a couple staff members that actually speak Nepali, and we also have on-site translation services that can be in the exam room, be at the check-in counter, on site to help us break down that language barrier in our facilities. So this slide here just kind of runs down some of our key collaboration partners. This is not an all-inclusive list, but these are just some of our top ones. Starting off with Quest Diagnostics. So Quest Diagnostics is an organization that we have in all of our locations at Access Point outside of our mobile unit. Quest Diagnostics will perform all the blood draw orders that we need for patient services, and also run, if there's a urine sample that we need a deeper analysis for something that we need, confirm a pregnancy or see what's deeper inside of a urine sample that our equipment can't detect. Quest Diagnostics can run that for us. Having Quest Diagnostics on site at all of our locations is just another layer of service that we want to provide to the community, because we can diagnose, but if there's something deeper that we need to know, the patient can get that blood work done in our office. They don't have to go to a separate Quest Diagnostics site to get blood work done, which creates another barrier to healthcare, because now the patient may not be able to get to a Quest Diagnostics. They don't have to worry about that because we have them on site. And then having them on site allows us to get results quicker and leads to better health outcomes. Tiffany's Mammo Van, that is, if you don't know about Tiffany's Mammo Van, they are an organization. They have a big, like 18-wheeler type truck that comes out to organizations. They come in our parking lot. They visit all of our sites quarterly. So if we have since we don't have mammogram equipment or to do mammograms on site, that we partner with them. They come to our organizations throughout the year. They will run mammograms in our parking lot with their equipment, and then we get the results back to us, so we can properly care for patients who may be at risk for breast cancer. Kent State University, we have a good relationship with them in the sense that, especially in our Kent location, if they have nursing students who need externship hours, they can come. We take on students and show them, what it's like to work in a community health center, as they need the externship hours for their degree. Same thing with University of Akron. We partner with them to have students come in at our Arlington location, and eventually here at HealthQuarters in the future as we get ramped up. Akron Metropolitan Housing Authority, AMHA. So that is a organization we use to help patients who are having a hard time finding housing in Summit County. for whatever circumstance they may be in. We can help them with applications for housing via our community health workers. NEOMED, don't have to really go into that, but NEOMED, we do have, especially in our pharmacy, we have some students who are doing pharmacy tech interns and things like that. We partner with them to have students. We have some staff members as well through NEOMED in our pharmacy. Coleman Health Centers, or Health Services, sorry. With Brooks here, and we'll talk about our collaboration a little bit more. LeBron James Family Foundation and the PEGS Foundation are another key collaborations that brought the I Promise HealthQuarters dream to reality. All right, so some other additional services at Access Point. So we have a sliding fee scale. So sliding fee scale helps patients who are uninsured, or even if you do have insurance and maybe you have a very high copay based on what your plan provides. Our sliding fee scale can help patients get a heavily reduced copay for their appointments. So the way we calculate our sliding fee scale is based on household income and the number of people that live in your household. So if a patient's working, we ask for a couple pay stubs just to see what their average income is, and then that calculates where they fall on our sliding fee scale, which it could be, we could talk about a $200 appointment could be dropped down to $50 or $25, depending on where they fall on the poverty level. So we highly encourage every patient, insured or not, to sign up for a sliding fee scale because, hypothetically, real quick, if you had a $50 copay for your primary care through your employment's insurance, but your sliding fee scale puts you in a $25 bracket, you're going to pay the $25 copay versus your $50 copay. So we're trying to find ways any way we can to help patients not have that financial barrier to healthcare. Community health workers. So right now, not at I Promise HealthQuarters, not yet, just because we've been open for a few months, but we plan to in the future. But all of our other sites have community health workers. Those community health workers help patients with a lot of the services outside of the medical, dental, optometry, pharmacy services. So like I mentioned earlier with AMHA, if a patient needs help with the application, our community health workers can either meet them on site at Access Point, or sometimes we even meet them at their home, at their current home, or if they're unhoused at the moment, we can meet them at a library, anywhere to help them with that application. They help our patients get connected to food banks and food pantries in the area if they're struggling to get access to healthy foods. And another great thing, a couple great things, is that they help with transportation. So like, for example, in Kent, we have a great relationship with the PARTA bus system and out there where we can help patients get reduced or free bus passes. And it's not just to Access Point locations, that's just to get them to work, to wherever they need to go, and just to help break down that financial social determinant of health. And another thing that our community health workers help with, among a lot of other things, is this time of year, things start to get cold. Patients are having a tough time paying, the utility bills. We can actually work with your utility provider, gas company, wherever the case may be, to help you get reduced utility bills. If your furnace breaks or if your AC breaks, we've helped patients kind of cut through the middleman and get either a free unit or free labor cost installed. Our community health workers go above and beyond to help the community outside of their medical diagnosis or whatever they may be going through inside of our Access Point locations. Sorry, what was our next thing? Sorry. Mobile meals. Mobile meals. Some of you may know Mary Helen Oregon. She's kind of our director of community development and community engagement. She runs our mobile meals program out of our Cuyahoga Falls office to help patients get nutrition and meals. And then kind of the last touch point, additional service that Access Point offers is transportation to Access Point locations. So we partner with Emerald Transportation. They're an organization that we partner with. If a patient has a transportation barrier, I can't get there, or my car was in the shop, I'm not going to be able to make it, but I really need to get in because I need my refills. We will schedule that appointment. Right now, we're working on a 7-day lead time. We're hoping as we increase and get more volume to cut that lead time down to show, hey, we have a higher need. We need a 3-day lead time, whatever the case may be. But right now, it's a 7-day. So we schedule that patient for a week out. We then reach out to Emerald Transportation with the patient details. And then they coordinate pickup at the patient's home. They will either, depending on the length of the appointment, they will stay and then take the patient back home, or they'll come back and pick up the patient once the appointment's over and take them back to their home. So that's just another way that we're breaking down those social determinants of health that we hear about in the community that prevents people from getting access to healthcare and better health outcomes. And transportation is a big one for sure. All right, pass it over to Brooks.
All right, so just a little bit about Coleman. Our mission is to foster recovery, build independence, and change destinies. We also aspire to improve health and mental wellness of our communities through compassionate, evidence-based services and supports. A little bit about our history and where we come from. So we were founded in 1978 as the Kevin Coleman Center in honor of a resident of Portage County, Kevin Coleman, who was extremely passionate about mental health and providing and handling crisis services. So in 1985, we expanded beyond Portage County to 10 additional counties across Ohio. And currently we are serving over 40 counties here in Ohio, providing a variety of different services among each of those counties. In 1996, we moved from and changed our name from the Kevin Coleman Center to Coleman Professional Services in order to highlight some of the professional services that we have available for individuals in the community. And then more recently, here in 2021, we changed our name to Coleman Health Services in order to reflect some of the focus that we have on the whole person treatment. Some of the services that we provide here in Summit County and across other counties, and we don't, some of these services are not necessarily in Summit County, but across counties, you'll see any of these variety of these services. So we provide behavioral health services, of course, which are, of course, looking at things like crisis intervention services, addiction treatment. We provide 24/7 hotline and walk-in appointments available. There are certain days here specifically in Summit County that we have diagnostic assessment scheduled where people can walk in and get an assessment same day. We also have counseling for youth services for youth, adolescents, adults, and families. More recently, over the last few years, is when we really started to focus and ramp up our services for young people. Prior to that, Coleman was really had a focus primarily on adult services. So I come from working with youth and adolescents, so I'm really excited about the services that we can provide to younger populations of individuals. It also includes behavioral health services, of course, also include case management and psychiatry. Across various counties, we have residential services. We have supportive services, including like peer supports for mental health as well as substance use needs. And we have elder care services where we also offer adult day services in Portage County specifically. We have employment services that can help individuals with identifying employment needs, learning and working on creating a resume, interview tips and skills, and just preparation. And then even after folks are employed, kind of helping them post-employment. We have several social enterprises. So as you know, Coleman Health, maybe you don't know, Coleman Health Services is a nonprofit behavioral health organization. So, but we also have social enterprises that sort of help, that are for-profit, that help to fund some of the services that we provide. So we have Coleman's Data Solutions Services, and then we also have, which is in Akron, we also have the Bean and the Baker, which is a cafe that is in Ravenna. We also work with Ohio Rise, which is a partner of ours that provides care management to connect kids and families with services in our area and wraparound services as well. We've also worked with the First Episode Psychosis Services, providing services for individuals who might be experiencing psychosis or other more severe mental health issues or concerns. Across, I want to say 10 counties right now, we have MRSS or Mobile Response and Stabilization Services, Summit County being one of those, and specifically some of the services that we will be providing out of the I Promise HealthQuarters. where we can come on site at the time of crisis to provide services for folks who are under, I want to say 21 years old, 22 years old. Or if there's a youth that is living with their grandmother, but the crisis is affecting them, they can still provide services to them on site, and then can bill Z codes and then provide services for or referrals for additional services if necessary. And then, of course, we partner with 988 Suicide and Crisis Lifeline. These are just some of the demographics about us from the 2023. As you can see, I'm just going to only highlight like the largest population or age range that we serve is at 30 to 64 range, but we serve all individuals across the lifespan. Here at the HealthQuarters, that is something that we really have been wanting to highlight, is that the population of individuals that we serve will cover the entire lifespan from pediatrics all the way through elderly folks. So we also have served in 2023, we served over 30,000 individuals total. We have provided crisis calls and provided services through crisis calls and text for over 54,000 individuals. And other 30,000 plus individuals we served, 541 of those individuals were vets, which is really an honor to be able to serve folks who are veterans. And our employment has increased by 30%, our staff. We currently have over 821 employees, 715 of those are full-time employees. I didn't get to say this in the beginning, but I want to just thank everybody for having us here and for listening to the things that we're doing. I'm really honored. I think it's really important for the work that Rob and I are doing here in our community between our organizations to provide services to anyone that is needing the services. I will say that we also opened, so some of the work that we're doing is still being streamlined and still being tightened up. We just opened our facilities in July of this year. The building just opened, so we're still we're in our beginning stages of some of the work that we've been doing, but I think we've been doing pretty well. So we're pretty excited about all of the work that we're doing.
Yeah, so I once like to echo Brooks's plan. Thank you all, and this is important to us, and we're glad to share this with you all and to bring the awareness and integrated care model that we were trying to build here at I Promise HealthQuarters. So on that note, let's talk about now. We talked about access point as a whole and Coleman separately. Now we're kind of tied all together here. So the integrated care model that we're putting together here at HealthQuarters starts off with a referral process, streamlined referral process. So for example, from an access point standpoint, patient comes in for a standard appointment, they're here for back pain. During check-in, all of our patients receive a PHQ-9. If some of you don't know what that is, or if you don't remember, that is the kind of a baseline questionnaire for depression. Excuse me. So they answer those questions at check-in. They will give the sheet to our clinical support staff, and they call them back to start their appointment. The clinical support staff will enter the answers to those questions in our EMR, and then if there's a concern, sometimes what will happen is the provider will shift the reason for the appointment to that depression. If we feel it's severe enough where we need to just, I know your back pain, your back hurts, but we need to worry about, your mental well-being right now. So the provider, our provider staff will talk about that, get a little bit more information. And if our provider deems that or feels that the patient is in need of any behavioral health or mental health services, they'll create the referral process where we have a template here at HealthQuarters that we fill out. We will then put all the details, patient demographics, some of the symptoms they're going through, depression, anxiety, whatever the case may be. And then we will hand that at checkout and discharge. We are going to then physically hand that referral to a Coleman representative. We're going to also walk that patient over to the Coleman side to meet with someone like a Brooks or someone on her staff if Brooks isn't available. So make sure we have that warm transfer. A lot of the healthcare system, it's, oh, hey, here's this number, call them. and they'll see when they can get you in. And now all that the patient's already stressed enough. They're depressed, they're anxious. Now you're just giving them a piece of paper and saying, hey, go take care of yourself. That's the broken model. We want to change that. So with us being in the same building together, it really breaks down that, takes away that patient responsibility, and it shows them that, hey, we're here for you. We want to make sure you're going to get taken care of. So we're going to walk them over to Coleman, meet with Brooks or whatever the counselors, and get them scheduled. The goal is for them to best as possible, and it's not 100% foolproof, but we want to have high 90% range of they're not leaving our facility without an appointment scheduled, or at least know that they are safe to leave our facility. So that's kind of the access point side of things. And then Rose can talk about from the Coleman side of our referral process.
I think some of the beauty in this warm handoff is, and I'll go a little bit over the why of the I Promise HealthQuarters, where that came from, like after we finish some of this, but it allows folks to really be able to see the person potentially that they are going to be working with before they even come in for their appointment, right? They get to meet people for counseling. Counseling is a lot more scary. I think physical health care is scary also, but mental health care services, counseling, case management, some of those things can feel a little bit more personal for folks. And so being able to see the person that will be working with them or meet the individual makes folks feel a little bit more safe and secure.
Yeah.
So when we have our case manager, if he's out and about with a family providing services to an individual, those individual, and something comes up where he learns that they haven't had a doctor's appointment, or they haven't been to the dentist, or their child hasn't been, in that moment, he can actually call with them to schedule them an appointment. Here in the office, if one of our therapists is seeing someone and they learn in those sessions that there's some things that need to be kind of like, we need to make sure that this is not a physical health concern before we address the mental health components, we can and they don't have a primary care physician, or they don't have a dental or or pharmacy or whatever they may not have, we can easily just walk them over. It's really nice to be able to connect them and get them scheduled right then on site for an appointment if they haven't already been scheduled, or to have them complete the initial paperwork. As we all know, paperwork is a pain and it's a lot of information. And so we can sit down with them to complete the paperwork if necessary. But they can also have that paperwork completed before their actual appointment is scheduled. So when they actually come in for their appointment, they can just be seen. So I think there's beauty in that warm handoff that we have here.
For sure. Another way that we're, creating a good integrated care model is through our I Promise HealthQuarters care meetings. So what those are is it's a joint meeting between access point members, such as myself and our doctors and nurse practitioners who see our patients here, and the Coleman staff with Brooks and her counselors. We are going to meet routinely and maybe quarterly, and we'll talk about the day-to-day meetings in a little bit. But we have like planned quarterly meetings where we're going to sit and talk about our mutual patients. So from the access point standpoint, we're going to bring in, okay, have they come to their appointments? Have they missed any appointments? Their primary diagnosis, how are they doing during these appointments? Are we seeing signs of progress? So they're going to bring that information. Coleman's going to bring in their information from their counseling sessions. Are they missing appointments routinely? Are they showing up? Are they being forthcoming in these appointments? Sometimes, they may, like Brooke said earlier, during the referral process, they're meeting with Brooks or the counselors prior to leaving the building, so they feel comfortable. Now they're going to talk more to them versus when they come to see access point, they're just yes, no, not really giving us much information. So now we get to meet together and kind of plug those holes and fill in the gaps of provide whatever service may be lacking or needs more increased services. Now we talk together and we can plug those holes. So it's a great benefit to meet that way. It just gives us that opportunity to not fall into just a routine of robotic routine of, okay, patients coming in 3 months for access point, they're coming monthly for Coleman, and we're just kind of going through the routine. Are we actually, is the patient feeling better? Are we seeing any, is the patient getting any benefit out of this? And I think those meetings are, those routine meetings are great for us. And in between those meetings, if a counselor from Coleman needs to talk about something, hey, Robert's coming in tomorrow. Last time he said this, he said a couple things. I want to maybe run it through you guys because it seems to be related to his physical health. So Coleman and the Access Point we come to agreement where we can just come down the hall and just kind of have a quick conversation with our staffs prior to meeting with patients. Because it allows us to focus, it allows us to really pinpoint where we can do better for our patients in between our routine care meetings.
Yeah. So a few final points just kind of before we start to wrap up. But the I Promise HealthQuarters is a partnership with LeBron James Family Foundation, Access Point Community Health Centers, Coleman Health Services, and we receive a lot of support from the ADM board and some funding from PEGS Foundation as well. So we have a lot of services and collaborations to create this amazing location. And yes, I am biased about our location, but we also focus on evidence-based, trauma-informed, and culturally responsive services with the goal of becoming a nationally recognized model of integrated healthcare. So that was some of the startup and some of the reason why we really wanted to create this space. A lot of folks in our community were not going to get physical healthcare treatment or were not seeking behavioral healthcare services because they didn't trust systems, mental health or behavioral health systems. So we really wanted to really bring in a focus of cultural competency and trauma-informed, and I know these are buzzwords, but trauma-informed care, meeting people where they're at. We focus on enhancing our relationship, the relationship building with community members and partners in our community. As Rob was talking about, our relationship with each other has been vital, building these relationships so we feel comfortable knowing who we're handing off our families to, our individuals we're serving to, and knowing that they're going to get exceptional treatment and be cared about. We work to improve physical and mental health outcomes of those in our community. And we have also been really wanting to increase outreach and collaboration with other community providers. So it's not just about the work that Rob and I are doing and our folks at the HealthQuarters are doing here, but also what can we do with the I Promise School. We're not solely working with I Promise families, we're serving the entire community. But what can we do in the schools? What can we do with people who are unhoused? How can we support and serve the greater Summit County community and beyond? So we're really working to collaborate with other partners, other behavioral health or physical health partners or entities here in the community. And final, this is just a photo. I don't know if you want to talk about this.
Oh, sure. Yeah, I just wanted to share just a couple photos of the building with you all. So this is a shot of the front of the building with our big sign at the top with our logos and address. And just our new fresh paint and everything. So, and
we like our building.
We do. They did a great job. This is a view from the West Market side. So if you're driving down West Market Street, this is kind of a side view of the building. And then the last photo here, I want to finish because I think this kind of encompasses what we've been talking about today. So if you notice, and I'm not sure how big it is on your guys' screen, but if you look in the kind of left-hand side with the "We Promise" and it has the ... And then all around it, there are various sayings and catchphrases around this. And this is in our lobby, our patient lobby waiting area. So, we promise to treat every visitor with compassion and integrity. We promise to be best. We promise to trust, respect. All these things as you look around, and it's not just, it's not just the medications for your blood pressure. It's not just your session with the counselor. It is everything. You have crutches. There's the teeth for dental. There's so many things that are part of your overall health, and this I Promise HealthQuarters provides that for you and for the entire community. So this kind of symbolizes why we're here and what we do. So I wanted to make sure this is kind of the last thing you see in the presentation to kind of really absorb what we talked about today. So with that, we'd like to open it up to any questions or whatever you want to talk about.